The American Heart Association's scientific sessions attract more than 17,000 attendees annually with a global presence from more than 100 countries. Homemade meals may reduce risk of type 2 diabetes. Taking public transportation instead of driving was linked with better health. Even though heart disease and stroke are the #1 killers of U.S. women, few women say they feel a personal connection to cardiovascular disease. A 3D system may more accurately identify the best donor heart for a pediatric transplant.
What we were working on was trying to figure out a novel way to improve patient outcomes with pediatric heart transplant, looking at size fitting and try to expand the donor pool. Normally what's done is clinicians will look at the body weight ratio between a recipient and a donor, and based on that ratio they'll say that the heart will fit or not before they accept a donor. And they'll also use that for listing when they want to go to UNOS to try to get a heart. The problem with those methods is it doesn't look at the straight up geometry itself of the heart. There is with infants, they're so small that trying to get a donor heart that will fit them is problematic. Most donors are adults, so trying to fit that into a cavity space of an infant wouldn't work. The other issue that doctors have to face is because most donors are too large for infants or younger children, what they have to do is they have to expand the pool and try to grab a heart that would possibly fit safely for that patient. And we're trying to make it a little bit more accurate looking at the volume metrics itself of the heart.
Heart Association is doing this is by firmly embracing the concept of building a culture of health. This simply means creating environments where that healthy choice is the easy choice. We believe we can make a difference by helping people make healthy decisions wherever they are, at work, at school, at home, and at play. We're building this culture on a number of fronts. We are advocating at the national, state, and local levels, and we're helping communities address their specific health needs. The AHA is fighting tobacco through support of taxes on cigarettes, clean air laws, and easier access to smoking cessation programs. In addition, the AHA strongly opposes marketing campaigns promoting electronic cigarettes for youth. The AHA is also making it easier to find healthier food and drink options. We're advocating for a healthier food supply, including reduced sodium content, lower saturated fat and trans fat, and for improved nutrition in schools. A culture of health means healthy choices are affordable and available for everyone. That's why the AHA is encouraging innovative community development in low-income areas, more access to healthy foods, and safe places to exercise. And as suggested in a recent American Heart Association scientific statement on the social determinants of risk and outcomes, we must address health disparities by developing strategies that are linguistically and culturally sensitive. The culture of health is necessary at work too, because people spend so much time there. So the AHA is helping companies by encouraging comprehensive workplace health programs. And finally, a culture of health is one where everyone has access to high-quality health care. The Affordable Care Act is helping more people get insurance, and the AHA's quality improvement programs are helping healthcare providers ensure the proper standard of care. Our healthcare system is also striving to meet people where they are through ancillary systems of care using digital technology. At the Dartmouth-Hitchcock Medical Center, we are initiating a program with a leading technology company in which patients' data can be gathered using biometric sensors, instantly sent to the cloud, and continuously monitored by healthcare professionals. Critical treatment adjustments can be made promptly without the patient.
But the biggest news of the day came when the American Heart Association and Google Life Sciences announced their plans to work together on a $50 million 5-year project that aims to bring a fresh approach to fighting heart disease.